Good afternoon, Bermuda. Joining me for today's press conference are the Minister of Health, the Honorable Kim Wilson, and the Minister for Public Works, the Honorable Lieutenant Colonel David Birch. I will start this evening by expressing the condolences of the government of Bermuda to the family of Mr. Amon Brown, who was killed this week during a domestic-related incident. Our prayers and best wishes go out to Mr. Brown's family, friends, and colleagues. There has been intense speculation and heightened media attention in the circumstances surrounding the event which took place at Blue Restaurant. Some persons think that my decisions were harsh. Some think they were justified. Others think that they did not go far enough. This job requires me to make tough decisions every day, and over the past 4 months, the tough decisions have been like ants at a summer picnic, numerous. However, it is a responsibility that I take seriously, and my oath requires me to execute them without fear or favor. That much being said, there seems to be a new effort to extract political advantage while looking to besmirch the names of persons with headlines and rumor. My wife had asked me to take a few days off this week, and so the Deputy Premier was expected or supposed to be here today. However, I've come in to answer questions that members of the media may have, so that we can draw a line on this saga and return to the important issues that our country is facing during a pandemic that will continue to affect our island home, both health-wise and our economy. Beyond the public face of politics, which is played out in press conferences, in the House or Senate, or on the doorstep, there is a personal connection that is formed between those of us who choose to serve our country in this way. Inviting two committed and dedicated ministers of the government to resign gave me no pleasure. As I said in my statement on Monday evening, I am immensely disappointed in the events that led to this. However, as a country, we have worked too long and too hard over the past few months to contain the spread of COVID-19 in Bermuda, and our demands for public compliance with rules and regulations mean nothing if we are not prepared to live by them ourselves. I have spoken to both MP Keynes and De Silva, and I'm satisfied that they understand and accept my decision. Both men worked tirelessly during the months of the pandemic response to keep Bermudians and Bermuda safe and to support our economic recovery. Their energy and zeal demonstrated a genuine care and concern for the people of Bermuda, and I will remain forever grateful for their contributions, because few know how difficult it has been for those of us in leadership over the past few months, but they know what it feels like. I've asked the Minister of Education, Diallo Rebane, to serve as the Acting Minister of National Security, and the Minister for the Cabinet Office, Wayne Ferbert, to serve as Acting Minister for Tourism and Transport. It is my expectation to ask the Governor to make new appointments to the Cabinet next week, Wednesday. With those introductory remarks, I will now ask the Minister of Health, the Honorable Kim Wilson, to address the country. Minister Wilson.
Thank you, Premier. Good evening. Today, there were 283 test results received by the Ministry of Health, and none were positive for COVID-19. Bermuda has 149 total confirmed positive cases. As of today, we have 3 active cases in Bermuda, of which none are hospitalized. All 3 of these cases were imported. A total of 137 persons have now fully recovered, and the total deceased remains at 9. The average age of all of our confirmed positive cases is 60 years of age, and the age range of our positive cases is between 18 and 101 years of age. Overall, 56% of all cases are Black, 40% are white, and 4% are other or unknown. The source of all local cases is as follows: 45 are imported, 85 are local transmission with known contact, 16 are local transmission with an unknown contact, and 3 are under investigation. Bermuda's country status remains at sporadic cases, and the 7-day average of our real-time reproduction number is below 1. This week's positive cases are a serious wake-up call that COVID-19 has not gone away. With our low COVID numbers, it is perhaps easy to forget that we are living in the midst of a pandemic. But the reality is that we are, and we need to take the same precautions that we always have done to protect ourselves and our community. As I've said before, now is not the time for us to let our guard down. Having said that, I want to reassure the public that the Ministry of Health, upon receiving this week's positive results, moved immediately to contact those individuals, isolate them, and began the contact tracing process to determine who they may have had close contact with, both on the flight and upon being landed. Those potential contacts will then have been contacted by one of our public health officers who would have provided them with further advice. Contact tracing is a fundamental part of outbreak control that's used by public health professionals around the world to help to prevent the spread of infections. A contact is assessed to see how close they were to the confirmed case, which would include someone who had been in direct contact with them, and in this case, seated immediately near them on the airplane, for example. Following this assessment, we can categorize them into low or high risk and contact them to provide advice on what they should do. A low risk contact, for example, does not require self quarantine, but should practice physical distancing. Meanwhile, a high risk contact is required to self quarantine, remaining in their home or accommodation for 14 days and staying away from work or public places. This would be a person sitting near the person who is positive. Every passenger on the plane does not have to quarantine for 14 days. Only those who were close to the affected persons, and they will know this because a public health officer would have contacted them. We have the contact details of all those persons on their plane and all persons that arrive in Bermuda because of the travel authorization forms. As a reminder, quarantine keeps someone who might have been exposed to the virus away from others, whilst isolation separates people who are infected with the virus away from other persons who have not been affected. All passengers from this week's Delta flight received immediate email communications from the Epidemiology and Surveillance Unit explaining that a fellow passenger tested positive for COVID 19 and advising them of their next steps. To reiterate, all passengers from this week's Delta flights needing to quarantine beyond the standard prescribed time for them on arrival will be contacted by public health officers if they haven't already been contacted. However, all arriving passengers must monitor their health for 14 days, if applicable, depending on the duration of their stay, and take their temperature twice daily and record their symptoms on the symptom log that was provided to each traveler. Also, they should limit their exposure to others in the community as much as possible during the next 14 days. I want to stress this last point. If you are a passenger arriving into Bermuda, do not think that you can circulate among the community without precautions once you have received 2 negative test results. You are still not completely out of the woods yet until the 14 days has passed, even with those 2 negative results. So please continue to wear a mask, practice good hand hygiene, stay alert to any symptoms you may experience, practice physical distancing, keep a log of your movements, and try and restrict these movements as much as possible. I just want to close by reiterating that all information for travelers has been posted on the government website at coronavirus.gov.bm. Among the resources that you will find on this page is a quick guide to travelers' quarantine requirements. The guide breaks down the action a traveler must take into 3 possible situations. 1, if you have a pre-departure test plus an arrival test, you will be released from quarantine with a negative result from your arrival test. And this usually takes between 6 and 8 hours, though it can take longer at times depending on the time of day you've arrived. 2, if you do not have a pre-departure test, but you take the arrival test, then you must quarantine for 3 days, and then you are allowed to come out of the quarantine once you have the negative day 3 test. And 3, finally, if you have no pre-departure test and no arrival test, then you must quarantine for a minimum of 14 days. If you test positive at any time, then of course you must isolate for 14 days. Finally, with the summer in full swing, there has been a lot of questions about camping. And I remind you that we still remain under and a curfew is in place between midnight and 5 a.m. This prohibits being outdoors during those times and necessarily prohibits camping. In closing, I want to urge all residents to continue to wash your hands frequently, use hand sanitizer before and after entering any building or any store or public building, shield our medically vulnerable, and continue to wear your mask and keep 6 feet apart if you're not wearing one. Thank you.
Thank you, Minister Wilson. With the new imported cases, I have received repeated questions as to whether or not this is the right time to open Bermuda to the outside world, or should we have waited longer? The decision to open the airport to scheduled commercial flights is not about putting profits or the economy over public health. It is about making sure that people in this country have the opportunity to get safely back to work to provide for their families. Since we have opened the airport to scheduled commercial flights on July 1st, there have been 6 flights to Bermuda, most recently 2 flights arriving this afternoon. As airlines add Bermuda to their schedule, we will see more Bermudians returning home and more visitors to our island. It is important to remember that Bermuda's testing regime at our border is the most stringent regime in the world. There is no country that requires the amount of testing that Bermuda requires in order to keep our country safe. The Minister of Health has reported that since we opened the airport, 3 travelers have tested positive. This testing is in place precisely for this reason, to identify and isolate anyone who has the virus. We were able to test and get the results back quickly in order to inform those who are confirmed positive to ensure that they are quickly isolated. His Minister of Health has made very clear that a visitor that does not have clearance will not be boarded and therefore will not be allowed to come to Bermuda. We also recognize it is difficult for Bermuda residents to access testing whilst overseas, and we cannot legally deny residents entry into their own country. However, if the situation in the United States continues on its current trajectory, we may need to change rules to require residents who are traveling to the United States to require pre-departure tests before their return. We will continue to look at all issues, and as the Minister of Health has said, update our procedures based upon the risks that present themselves. I, however, want to ensure that Bermuda remains an example to the world on how you can manage the various risks that this virus presents, appropriately balance those risks to ensure that our economy can recover while we keep the virus in check. And the key to that is testing. And as I said, we have the most aggressive testing regime when it comes to travelers on the planet, and we are confident that this will help to keep our country safe. With that, I now invite Colonel Birch, the Minister of Public Works, to give an update on the work of the Cabinet Committee tasked with safely reopening Bermuda. Minister Birch.
Thank you, Premier. Good evening. I'm happy to provide an update on the work of the Cabinet Committee on reopening since the implementation of Phase 4 last Wednesday, July 1st. To remind what requirements are still in place, permitted gatherings are set at a maximum of 50 persons. Requests for larger gatherings must apply to the Minister of National Security for permission with a plan to include social distancing, the wearing of masks, and other requirements. Masks must be worn indoors. Masks must be worn outdoors if physical distancing cannot be maintained. Curfew shifted to midnight to 5 a.m. would be reviewed weekly. With regard to the curfew, as indicated last week that it would be reviewed weekly, the recommendation to the full Cabinet this week was that it remain in place and be reviewed next week. With regard to gatherings larger than 50 persons, requests must be made to the Minister of National Security, who, following the initial assessment by the team in the ministry, it is referred to the committee. Following the events of this past week, it is clear that a number of things must now happen. Firstly, a complete review of the protocols and how they are communicated to event organizers. Enforcement protocols must be enhanced so that the requirements necessary for approval are adhered to, such as confirmation that rules are actually being enforced, spot checks at establishments, especially liquor establishments, recording of names and contact information, adequate sanitizer, and issuing the appropriate sanctions for noncompliance. We are seeing an increase in requests for events with groups larger than 50 of varying types of requests. As such, the Cabinet Committee will meet tomorrow morning to discuss and provide greater clarity to those guidelines. With regard to activities of a cut match, such as camping and the use of beaches, we will take these matters up at our next regular meeting on Monday. We are mindful of our traditions of summertime in Bermuda, and especially during this month, where in my office I am completely surrounded by those people in blue and blue. We are also mindful that we are in the middle of a pandemic that we as a country have navigated very well. Most of us have followed the rules and the health protocols put in place. And of course, the increased testing regime has resulted in our current state. With that, I wish to assure the people of this country that it is what has guided and will continue to guide our deliberations and recommendations to the Cabinet to ensure that we retain the position that we currently are in insofar as managing this pandemic. Thank you, Premier.
Thank you, Colonel Birch. As more Bermudians are returning to work, I want to reiterate what the Minister of Finance stated last week. If you have received money through the Unemployment Benefits Program, companies and individuals must notify the government that they have returned to work. You can do that by visiting bermudajobboard.com and follow the link at the top for COVID-19 unemployment application, and then click Back to Work form. As we prepare for another weekend, we must remember all we have learned in the last few months about containing COVID-19. We are in the midst of summer activities, which include spending time with family and friends, enjoying the beach, boating, and other outdoor activities. Inevitably, many of these activities include alcohol. If you plan to drink, please don't drink and drive. Remember to maintain physical distancing, wear a mask, and wash your hands with soap and water. When soap and water are not available, use hand sanitizers. It is a simple refrain. I know that I sound like a broken record, but the truth is that this is the most effective way to ensure that we continue to keep this virus at bay. The responsibility for helping to keep the COVID-19 confirmed cases low lies with each of us, and is especially important now as we have reopened our borders and we have a few imported cases which we believe are appropriately managed, but we have to make sure that we are extra cautious. With that, I'm happy to take any questions that members of the media may have.
Good evening. Premier, earlier this week, an investigation was launched into the firing of the two ministers. It was stated an in-depth investigation. How far will this investigation go? There are many videos circulating in the community, as well as a saxophone player it stated could have infected a whole room full of people. As the World Health Association organization has just released an update stating and affirming that coronavirus may be airborne indoors, which can put people in close proximity of each other at risk. Should these individuals be retested that were at that facility?
Should they be tested, Mr. Wilson?
That's one. And the other part was the investigation. How deep is this investigation going to go?
The investigation was looking into the circumstances of the event. I know that the Minister of Health might have further comments to make regarding Blue restaurants and sanctions which may be issued under the act to the restaurant itself. And that review has resulted, as I had said, and indicated on Monday in the request of the resignation for two ministers of the government.
Trevor, with respect to the review concerning the circumstances that we've that you're referring to, that is still ongoing. I have been in discussions through written correspondence with the proprietors of Blue, and that matter is still, like I said, being investigated, so to speak, under review. And then with respect to the testing, if it is, you would have heard, no doubt, I hope you were listening to my comments with respect to the importance of contact tracing. And if during the next 2 weeks or so, somebody tests positive for COVID-19 and we during the course of our contact tracing, trace them back to the events of last week, then depending on whether those other persons are low risk or high risk, then that would determine the extent of any type of testing that might come as a result of persons that test positive, if people do test positive following that event. So we have to kind of play a wait and see game. But again, my statement referred specifically to the steps that are taken for contact tracing. And depending on those circumstances, then there might be need for us to do testing, depending on what is revealed, if anything, following those events.
Thank you. Thank you. TNN understands that the persons arriving on those flights that tested positive have not been fit tested with the monitoring bracelets. Why not? And what is the delay?
Thank you, Trevor. We are, as I've indicated previously, we have the bracelets and we are utilizing them as quickly as possible. We are trying to ensure that they are fit for purpose, so to speak, with respect to their usefulness. They have been tested. We've had a number of volunteers. You may have seen people walking around the street with the bracelets on, just testing them. The persons that you're referring to that have arrived have been in constant contact with the public health department. So the case managers have been working with them and speaking to them on a regular basis. One of them several times, most of them several times a day. So prior to the use of the bracelets, you would have noted that the way that we did the contact tracing and the case management was through phone calls, and the nurses would contact those persons, make sure that they were tracking their symptoms, taking their temperature twice a day, and so forth. That mechanism still exists until such time as we are able to fit the bracelets on the individuals. One of them, I believe, was going to be fitted today, but that was being worked on as I was leaving the office to come here.
Thank you. This question for Premier, Honorable Premier. Premier, I'm not sure if you're aware of an extremely dangerous drug on the streets of Bermuda, MDMA, aka also known as Molly, ecstasy, and the extremely mind-altering substance, which is running rampant in our island. When are we going to take a serious look and tackle these real issues plaguing our young people?
Thank you. I'm not particularly aware, but regarding issues that are dealing with drug control and prevention, I'm happy to ask the Minister of the Attorney General and Minister of Legal Affairs, who has responsibility of drug control and prevention under a remit, to have the conversation and discussion with TNN on those matters.
Thank you, sir. Minister of Health, is there any updates for the nurses aides that are extremely in difficulty with earnings, one wage, that have their second jobs at those other facilities? Are there any updates? Because they are, their questions are they're extremely finding it very difficult to survive.
Right, and I appreciate the concerns, and I actually applaud you for raising that week after week, because obviously they are speaking to you about it and it is of concern to those individuals. However, the position does remain the same. As I've indicated as recently as last Thursday, we are looking at that position. However, when you open up the borders, the lag measures, the time that the events that take place after you've opened up the borders could trigger certain further events. And one of the lag measures as it relates to the nursing homes is, I believe, 28 days. So we do need to see what impact, if any, opening up our borders has with respect to our vulnerable populations that are living in those nursing homes. So again, I applaud you for raising that. And it is a consideration that the subcommittee, the cabinet subcommittee, oftentimes discusses. But the reality is, as I've spoken about last week, it is still a very sensitive topic because of the vulnerabilities of that particular population.
I mean, to state, they feel that they're being penalized because the contact tracing to those seniors' homes were not brought in by nurses or nurses' aides. I'm not sure if your investigation indicates that.
I'm not 100% sure what you're referring to about the contact tracing.
nurses aides or nursing bringing the coronavirus to the seniors aides. They feel they're being penalized.
I can appreciate their concern, and I can assure them that they're not being penalized. They just happen to work in an area that unfortunately is extremely high risk for transmission of COVID-19.
Thank you. Premier, some weeks back you mentioned about antibody testings. Are we still doing antibody testings? That's one, because the World Health Organization has indicated that the accuracy is only 20% of these testings. And the current testing that is being done at the government led by Dr. Karika Valley and her team, these results that are coming in, even if they're negative or positive, being retested to come to that final conclusion?
Regarding antibody tests, I know that we had received another shipment back in April with a sample of which was obtained. The Bermuda government, locally, we were able, with the interaction of Dr. Weldon and a local doctor, were able to validate and verify these tests. We ordered these tests, and these tests were then given the Food and Drug Administration of the United States emergency use approval as one of the few lateral flow antibody tests that are available. As was stated, in their detection for IgG antibodies is at 97.2% of specificity. So they are very good tests, and that is the reason why they were given emergency use approval by the United States Food and Drug Administration. So we're confident in those tests that are being administered, and I think that they'll give us a good insight into understanding I would say, the exposure of this virus in the community. It's important to note that these tests are not used for diagnostic purposes. Diagnostic purposes is the PCR test which were used, which has viral RNA, and that is the way that you can diagnose an active infection. And the PCR testing which we're doing throughout the country still has Bermuda amongst the top countries in the world per capita of making sure that we continue to administer these tests.
My final question, Premier, for you, going back to the Blue Restaurant incident, were you aware of the exemption granted? Did you support the exemption? And was the process fast-tracked?
I can't speak to whether the process was fast-tracked because I'm not a part of those processes. I think that ministers who sit on the cabinet committee can say so. Regarding whether or not I was aware of it, I received an email on Thursday, July 2nd, and noting that the exemption was going to be published, as is part of the law, where the regulations state that anything has to be published a day before it takes place.
Good evening. Premier, I'll start with you where you started by expressing condolences to the family, friends, and colleagues of the latest murder victim. With regards to that, I realize that the minister who issued the contract and extended it is no longer in your cabinet, but for the critics who say that gang violence and all of this antisocial behavior is continuing, outside of curfew hours, I might add, to those who say the money's paid to date and continuing to be paid to Pastor Leroy Bean is a waste of the taxpayers' time and money.
I will say that I could not disagree with those statements any more strongly. I know the work of Pastor Leroy Bean. I speak to him on a regular basis, and I understand the incredible work of which he's doing inside the community. The fact is that gang violence did not start in Bermuda in a very short time, and the work of which we're going to do insofar that the government has committed about tackling root causes, dealing with issues of opportunity, dealing with issues of making sure that we deal with these particular matters in a holistic fashion and not just from an enforcement action, will take time to bear fruit. But I do not accept those remarks in any way whatsoever, and I know that Pastor Leroy Bean, in addition to his team, does exemplary work for this country. And I strongly think that we owe him an intense debt of gratitude, and that is being paid by the money in which he's being remunerated. But for someone who works late hours, for someone who works early hours, for someone who's on call throughout time, and his supporting team, I think that it is the right strategy for the country, and we are going to continue to push forward with that strategy. What is also important, however, is during this period of pandemic response and talking about how we move forward, I think there is certainly going to be more time and opportunity for us to make additional investments inside of, I would say, capital structures and others to provide not only work for persons who may be looking for work, but also to make sure that we enhance the community support, which is in place for our young persons.
With regards to the Blue Party, were you aware of the party?
I was not.
Did you go to the party?
I did not.
For your other MPs who did you castigate them as well?
I have no idea of anyone who else who attended the party except for the two
For
ministers
those with
noted.
the petition calling for Mr. Kane's reinstatement, for the record, can you tell them whether that's even on the table?
There is no consideration of reinstatement for the ministers who have resigned from the cabinet.
So they're not coming back.
There is no consideration of reinstatement for the ministers who have resigned from the cabinet.
Okay, thank you. Colonel Birch, you said that you're mindful of the Bermuda traditions like camping and summer activity, and that the committee will reconsider the curfew next week. I don't know about St. George's people, but Somerset people want to know, can they camp out all night? So are you keeping that in mind?
Absolutely. That is what we are considering. And so it'll be based on a number of factors, how well we behave, and we have been. And so that influences our considerations. But I guess the most significant portion of that is the assessment of the risk from a health perspective. And so we'll have fulsome discussions on that long before we get to cup match and
There was
community.
some talk about this big series or biggest party at Middletown. Were you aware that these parties are going on?
I was not.
Evening, Mr. Premier. Evening, folks. Jonathan Bell from the Gazette. Yeah, Ms. Wilson, I'll start with you if I could. Yeah, we've heard regarding the party at Blue. Sorry to keep going back to it, but that you weren't happy about it. That you were keen to stop that event from going ahead. Can you confirm if that was the case?
As Mr. Birch indicated, that part of that process with respect to evaluating whether or not persons that make applications for an event over 50 goes to the Minister of National Security, and then the subcommittee obviously meets. All of us have an opportunity to express our views.
Thank you. And I've heard what you said about our aggressive testing regime. It's very stringent. We have heard of some cases, just anecdotally, of visitors who say they've waited a bit of a long time. And we heard in one of the recent press releases about people who didn't know where to go for I believe it was the third day of the test that they've got to get. Are we just using Southside for testing at the moment? Is that sufficient for the numbers that may increase?
We're actually using a number of locations. Hamilton Cathedral is the central location. So there are a number of locations where persons are able to, depending on the day, because you can appreciate everyone's day 3, 4, and 7 is different. So it depends on what facilities are open, but that information is communicated via email from the public health department to the particular traveler, instructing them where to go and encouraging them, in most instances, which they do, they make their appointment in advance so that depending on where they're going on what day, what we are looking to do is to find a permanent location that's not necessarily beholden to the weather. So we are looking to do that. And once that's been located, then we'll be making those announcements as well.
Got you. Thank you. Bear with me. Oh, yes. So we are approaching the end of the unemployment benefits. It's been going on for some time. Probably, Mr. Premier, are you able to outline at all the plans for the repatriation of workers when their benefits run out, switching people over to financial assistance? must be a big task. Can you speak at all as to how we're going to handle that?
Absolutely. Those are discussions which have been held with the minister responsible for labor, who is communicating with the minister responsible for finance. There's a couple of things in that. Number one, the unemployment benefit itself was meant to be short term. The persons who may not be Bermudian who are receiving the unemployment benefit were there receiving that benefit, even though they are not eligible for financial assistance, on the view that they could not return home. Clearly, persons are able to now return home with the reopening of the airport. So any extension of those benefits will certainly not apply to those persons who are able to return home and who are not working. Regarding the transfer of the persons from the unemployment benefit to something more long-term regarding financial assistance, the Minister of Labor is working through that process inside of his ministry, and will have an announcement shortly, and will be likely making an announcement to the House of Assembly, if not when the House of Assembly meets on the 17th of July, on the 24th of July. But it is something that has to be considered, long-term support for persons who are unable to work. But we must remember that the unemployment benefit was meant to be temporary. Non-Bermudians were included in that, even though they are ineligible for financial assistance, under the basis that it would be impossible for them to leave the country as the borders were closed. But now that the borders are open to flights, persons who are able to repatriate back to their country should do so.
Are air bridges a possibility? I see Cayman is doing, sorry, air bridges. I see Cayman's doing that. Is that a possibility with these folks? Some of them, if they don't have any money, for example, to buy a ticket home?
We don't necessarily have to do air bridges because our airport is open to regularly scheduled commercial traffic. I think the Cayman Islands airport is not open to regularly scheduled commercial traffic. So that is the reason why they would have to do air bridges. But our airport is open to regularly scheduled commercial traffic, and persons are able to go ahead and travel. There are no travel restrictions to people who are traveling from Bermuda to either the United States or the United Kingdom.
Thanks, sir. My fourth one was regards to protective equipment and test kit supplies and all of that. We've got these numbers are just soaring in the U.S., and that was a problem for us at the start. You know, there was this tussle for all of these supplies. Is that going to affect us? Can you speak to how our supplies are at the moment and how they're looking ahead with the numbers just going up and up and up in the U.S.?
We are, Jonathan, continuously securing and procuring more and more testing supplies. We're noticing that our burn rate is increasing rapidly because of our testing capabilities and the fact that we are aggressively testing all those persons that are arriving in Bermuda and testing them on days 3, 7, and 14. So you can appreciate that does have an impact on the PPE usage. But again, we continue to source PPE from various locations, north, south, east, and west of Bermuda, recognizing that there are still items that are short supply, but that's just a constant process that continues to evolve. But we are certainly conscious of that. If you look at our indicators that we've spoken about, that is one of the areas that the red, gold, and green indicators we spoke about a couple of weeks ago, and that's one of the areas that we have not gone out of the red yet, which is with respect to ensuring that we have PPE. There are certain items that I've spoken about previously, which is gowns, that we do have a short supply, which is why we have engaged local seamstresses who are making reusable gowns. So those can be used as opposed to us trying to secure something that we know is a worldwide shortage. But it is critical, and we recognize the importance of that, which is why we are using that as making that a priority to ensure that we take steps to procure as much as we can and from wherever we can get it.
Thank you. Last two could be for you as well. I've been hearing it. I didn't particularly mind the nasal swab, didn't like it, didn't mind it that much. People have asked about the saliva test, when we're going to get that, and is that going to put us in a place where we don't need the nasal PCR test anymore?
Well, the gold standard for testing is the PCR, the nasal test right now. However, we did receive the saliva test, but they have to be validated, and we have to validate it with persons that are positive. So the person that's positive has to take the nasal test as well as the swab at the same time. Fortunately for Bermuda, we haven't had a lot of positives. We've only had the first 3 subsequent to us receiving our the saliva test. So we have to do a minimal of 10, and on one hand, we don't want to say we want more positives, but that's the only way we're going to be able to validate it is with positives. So that is an ongoing process, but it's not imminent because of the lack of positives that we have in Bermuda at the time.
Gotcha. Last question regarding the person who, I think on the first flight, the Air Canada flight, and just went straight off to that restaurant. Can you tell us about the investigation in that? We were trying to find out where it had happened, if there was had to do a bunch of contact.
The restaurant in question actually were very, very diligent, and they immediately contacted they called 211. They called the COVID hotline. The COVID hotline were able to communicate that information to myself as well as other members of our team. We got the police involved. Port Health happened to be in the vicinity. But again, it was because of the diligence of that particular restaurateur and the manager in particular, who overheard a conversation about somebody who had just gotten off the plane. The person, they did really well. They did everything that we expected them to do, and they have to be commended. And they requested the persons to leave. They immediately contacted us and provided us with the details that every restaurant is required, taking the contact details of the persons that's made the reservations or wherever they're sitting. So that was followed through, and that matter has, I think, been closed actually.
Thank you. I think that does it for me.
Good evening, everyone. My first question, were the 2 flights that arrived this afternoon, were they included in the results tonight that you mentioned with the 283?
I wish we could move that quick, but you look at Owen, he's going like, no. One of them, they probably just finished a couple hours ago. So this would have been as a result of yesterday's results.
Okay, thank you. And also, Minister Wilson, just to clarify, you mentioned that for those people who may have come in without a departure test and also an arrival test, they would have to quarantine for 2 weeks.
Okay. If you do not have a pre-test, when you arrive, the first test that you get is here, and we call that an arrival test. You must quarantine for 3 days because you do not have a pre-test. And then you take the next test on day 3. And if that turns up to be negative, then your period of quarantine is ended.
Thank you.
So we're encouraging persons, of course, to have a pre-test, and particularly the locals, as the Premier said, because if you have a pre-test, when you arrive, then you're taking the arrival test, and you only have to quarantine for 6 to 8 hours until you get your results.
Okay, thank you very much for explaining that. My next question is for the beach and boating curfew. Has that extended since the curfew has also extended to midnight since then?
Yes, it was. So as of the 1st of July, you could stay on the beaches until curfew time, or early enough to get in time for the curfew.
And as for the boating?
The boating, I believe, is 11 o'clock. So you have to be off the water.
Thank you. My next question will go to you, Premier. I have had some inquiry from some students, some university students. They've tried to apply for workforce and development program jobs for university students. So as many persons are either unemployed or receiving the benefit or working part-time, many Bermudians do not have insurance, which means those who have children in university, they don't have any insurance right now. However, in order to apply for the jobs at workforce and development, they need insurance. And obviously insurance costs money, which they do not have at the moment. And if they don't have insurance, then their applications will be rejected. So what can persons do in this position? They're asking what type of resources can they get?
Thank you for the question, Ms. Palacio. I can certainly look into that. I'm not familiar with the specifics. I do know that there's a large number of students that are employed through the Workforce Development Summer Employment Program, both high school students and university students, certainly. I know there's a number in the cabinet office and a number at both of the ministers sitting to my right and left at their ministries. I was not aware of that specific requirement, but I'm happy to take that under advisement, to look into that, and to certainly get a response to you from the Minister of Labor regarding that specifically.
Thank you. And my final question being, Premier, are you planning on asking the community, if possible, for feedback on who they wish to become the next Minister of National Security or Tourism?
If there's one process that is not subject to democracy, it's that one. So it relies inside of my jurisdiction. So it's something that I will take some time to think over, to discuss with my colleagues, and I will go ahead and make that announcement on Wednesday's expected date.
And there are some persons actually I read on social media asking about more female representation in the ministry. So just wanted to bring that.
I'm certain, and there are many persons who have made that representation, and these are all the things which will be under consideration as I have to now turn my attention from where we are to appointing persons to the cabinet to pick up the slack due to the unexpected resignations of the two ministers in question.
Thank you very much.
No problem. Thank you, Ms. Blasio.
Good evening, Don Burgess for Bermuda Broadcasting. Strict post-arrival testing is critical to catching and containing the disease spreading into Bermuda. Bermuda Broadcasting has learned about several passengers who came off recent flights and who were not able to get a day 3 test or whom didn't bother to get the test for various reasons. Is the government able to quickly confirm in real time or at the end of each day which required persons have received their day 3, day 7, and day 14 tests? And how do you police and enforce this vital step?
There is a computer program. I can't think what it's called. Quest. I don't know the name right now, but it's a way that they're using to log the data so that they know when a person's day 3, day 7, and day 14 test is. So it's quite technical. We are aware that there were a few persons that because of the weather, they went on day 2 and or day 4. However, from a public health point of view, it's not that problematic because it was still a series of tests. And our main objective is to ensure that the persons are having regular tests, because as you can appreciate, a test just represents a snapshot in time. So you could have had a positive test on one day and then day 3, a negative test on one day and then 3 days later it could be positive. So the main thing is to have the consistent testing. And we gave some data last week about from Public Health England that suggested that if you have a pre-test as well as a test on arrival, then the prospects of detecting a person that's positive is 75%, and that percentage increases the more tests that you have. So we do have a format that's utilized a particular computer program that allows for the persons that work within the surveillance unit at the ministry to know exactly when that person's test is due, and they can monitor them and check them. And if they do not get a test or come and get their test, then of course enforcement measures are undertaken.
Thank you. We know that 3 people tested positive off the Delta flight. How many other people are having to serve quarantine because of close contact with them?
I don't have that number, but as I indicated, those persons that would have been in high risk, perhaps sitting in the close proximity of those persons, would be the ones that would be subject to quarantine. I don't know those numbers offhand.
Health Minister, one of the passengers from Atlanta had a negative pre-test, but a positive test at the airport. Clearly, one negative test doesn't mean you're in the clear. What can we learn from this example?
It illustrates again the importance of testing, because a test just represents a snapshot in time. And as the person that you've just spoken about had a pre-test where they were negative and then upon arrival was positive, which is critically important as to why we have such a rigorous testing regime, and that we're testing on arrival, day 3, day 7, and day 14. So it just confirms the necessity to have aggressive testing regime because of the fact that it only represents a snapshot of time with respect to what your position is in terms of positive or negative based on that day.
Thank you very much. Mr. Premier, statements from the former national security and tourism ministers clearly don't line up with the multiple videos from the party at Blue, i.e. the event wasn't ending. There were multiple people up out of their seats dancing, some of them dancing on tables. How disappointing is it for you that 2 of your former cabinet colleagues who have been preaching to the Bermuda public about social distancing and wearing masks were not only not complying, but also were not more forthcoming with the truth?
What I would say on the question which you asked, how disappointing is it? It's very disappointing, certainly, with the videos of which persons have seen and the circumstances surrounding that. But what I would say is that 2 dedicated ministers have paid the highest political price that can be meted out inside of the country. And that is the resignation from the position of a minister of the government. So from that perspective, it is disappointing, certainly. would certainly would have preferred to be sitting at this table today with the Minister of National Security giving his update, and certainly would have been preferred to be sitting with the former Minister of National Security, and certainly would have preferred to have the continued service of the Minister of Tourism and Transport, who has worked diligently to make sure that we can restart commercial traffic and make sure that we can get some of our hotels back open to ensure that more Bermudians can return back to work. But as I said at the outset, the job of which I'm charged with requires me to make difficult decisions every day. The decision of which was made, I think, is the best decision given the circumstances, and we will move on from this. We must make sure that we enforce standards, and I think that it is critically important that lessons were learned from this. As the Minister of Public Works has indicated, there's going to be review of the processes for these large events, and I'm certain that those things will be communicated as we go forward.
Thank you very much. Health Minister, sorry, that's already been answered. How are local taxi drivers being protected from transporting new air arrivals to hotels and residences and on trips around the island? And how are their subsequent passengers protected?
We have, as I've indicated previously, we have developed quite a number of guidance notes that can be located on the government website with respect to all types and manner of occupations, professions, restaurants, et cetera, taxis being one of them. So there has been established guidance as to what the taxi drivers should do to best protect themselves. And that information has been made public and made available to the taxi drivers.
Thank you very much. That was my last question.
Thank you very much. I appreciate the questions from members of the media. As noted, our government press conferences have moved to once a week. The next press conference will be next week, Thursday, July 16th. I wish everyone to have a very safe and enjoyable weekend, but remembering the rules of which are in place to make sure that we continue to give an example to the world how a small country can successfully manage this virus with everyone working together, pulling together, and making sure that we're doing what is necessary to reopen our economy, to be able to reacquaint ourselves while also making sure that we keep each other safe. So with that, I wish everyone a very good night, and I want to say thank you, Bermuda.